Welcome to your educational video on how to address problems with your Forsus or Crossbow appliance. By now you've had your Forsus or Crossbow cemented into your mouth, two pieces, an upper appliance and a lower lingual holding arch with a metal bow that goes around the front of your teeth. The appliance is attached to your upper and lower teeth through two springs, one on each side, that attach to metal bands on the upper and to a lock on the lower labial bow. Now we're going to talk about some issues that could arise and how to handle them at home. The most common issue you'll notice is that the spring is actually two pieces. We have a compressible spring that attaches to the band at the top and a metal rod that attaches to the bottom. Should they come apart, compress the upper spring, open as wide as you can, and slide them back together. You should be able to bite normally after this. If, for instance, you lose the lower rod and the upper spring is hanging freely, place a piece of floss carefully in between the arm sitting in the upper appliance, floss it through, grab the loose spring, gently tie the floss around, securing it several times, and that way we can ensure that the metal spring stays out of your biting surfaces. So after you secure it tightly, make sure that you use your finger to guide it away from the chewing surfaces so that you are comfortable until we're able to see you at your next appointment. The last type of issue you could run into is should you lose the top spring and only have the metal rod at the bottom. It's a little bit more difficult to secure, but again, place a piece of floss around the labial bow and tie it securely so that the knots of the floss sit in front of the lock on the bottom. This should be able to get you comfortable until we're able to see you again.